I'm going to show you the rib raising technique. This technique is passive and direct. Right now, Iana is seated up so I can demonstrate where I'm going to be palpating for this technique. And this technique, an indication for this technique would be to improve a patient's ease of breathing. So this could be helpful for a patient who has asthma or is recovering from an upper respiratory tract infection. So first we're going to palpate the spinous processes of the vertebrae and then move laterally onto the angles of the ribs, which are about here. And Iana, if you would lie back down for me, please. Thank you. So with the pads of my fingers contacting her rib angles, I'm going to create a fulcrum with my forearms on the table and apply an anterior and lateral traction to the angles of her ribs. So I'm going to be moving up and down her rib cage, feeling for restriction in motion, and applying this anterior lateral force to expand the rib cage and for restrictions there. And then I would do this technique bilaterally and then reassess it for any kind of hypertonicity or restriction in motion at those rib angles. And this technique can also be done with the patient in the lateral recumbent position if it's more comfortable for the patient, or with a practitioner on either side of the patient to further expand that rib cage and increase their ease of breathing.